in order to prevent and or reverse type 2 diabetes. Yes, it's possible. There are several key metrics that you have to be tracking if that is your goal to prevent and reverse it. If you're not tracking these, then you're guessing. And if you're guessing, then you're being complacent as far as your health and improving your health. And you're leaving it up to a practitioner, or you're leaving it up to a system that has shown you that they have no interest on your health improvement, especially when it comes to reversing this condition. In this video, I'm going to lay out several labs that are essential when it comes to preventing and or reversing type 2 diabetes. Stay tuned. What's going on, family? This is Edward Williams, licensed physician assistant and founder and creator of Health by Any Means Necessary. And I want to welcome you to our show where we talk about all things Black health improvement and insulin resistance. So if you're new around here, go ahead, hit the subscribe button, also hit the notification button. That way you can be notified every time we do a new video. All right, so before we get into the actual labs for diagnosis, there's a couple of things I want to say. First of all, the days of depending on your practitioner to help you improve your health in an organic way, in a way that is going to actually benefit you and your community is long gone. In fact, if you're African American, you never had that. So what we're about to go through right now, it's going to take a level of boldness and it's going to take a level of empowerment, but you have to have education backing both of those up. Now, what I'm talking about as far as boldness and empowerment is the fact that most people, when it comes to this condition, this diagnosis, are intimidated. They're intimidated with the diagnosis itself, but they're also intimidated by the practitioner and the staff. And so essentially what happens is you have a patient that is unempowered, they're unaware, and they're also uneducated as far as this condition goes. And so essentially what happens is you have a patient that is managing their type 2 diabetes for years and years and years on end until the first complication takes place. And then they're managing for years and years and years. And then another complication takes place. And then next thing you know, this patient may have to start dialysis. This patient may have to have a more severe or significant event or procedure take place. The only way you're going to prevent these complications from taking place and or reverse this condition completely is by being empowered and being educated, and also by tracking these metrics. Because if you're taking steps to improve your overall health, you have to have some type of way of tracking whether or not you're being successful along your journey. So we're going to get into this conversation about labs. We're also going to get into this conversation about practical things you can do at home, because I'm well aware that not everybody has a practitioner, has access to a practitioner that they can utilize, but also not everyone has insurance, and not everyone really wants to see their practitioner like that because they may not get along with their practitioner. Their practitioner may be arrogant. These are just all things that I have seen for myself, but I've also heard from so many patients. So I'm going to give you ways that you can possibly utilize at home to track your metrics, but I'm also going to give you ways to use it in the actual healthcare clinic. All right. All right, so essentially the labs that we're talking about is coming straight out of my book that I just finished writing called Done with Diabetes. If you want to get this book, go ahead, click the link in the description. It's a free book. All you have to do is pay for the shipping and we'll send it right over to you. Now, it's going to be important that you understand what labs to get, but you also need to understand what these labs are telling you and why they're important. You also need to understand what is considered to be normal, what's considered to be high, and what's considered to be low. And also what the problem is with these numbers being out of range. Now, for the video on complications, make sure you go watch the video I did called Insulin Resistance Explained. And that video will lay out the complications that come along with diabetes, prediabetes, and insulin resistance. So the way we're going to do this, I'm going to talk to those who have insurance and who can utilize their insurance. And then I'm going to talk to those who do not have insurance, or they prefer not to actually deal with their healthcare providers for whatever reason. If you have insurance, then that means you're going to be visiting your practitioner. This means that you have a certain level of benefits to actually cover the blood work. And so what we're going to do is list out several labs that are going to be important for you. First, if your goal is to actually prevent diabetes and or reverse type 2 diabetes, the first thing you need is a practitioner that knows that this is possible, or that's willing to actually work with you and believes that it's possible to improve this condition. That's the first thing you need, because if you don't have that, then you're not going to have a practitioner that's going to be willing or going to be motivating or encouraging to you when it comes to taking certain actions. So that's the first thing. The next thing you're going to need is visits. You're going to have to visit your practitioner. I recommend that you have regular routine visits every 3 months. This is if you're working towards reversing type 2 diabetes or getting your A1C down if it's at the pre-diabetic level. I recommend visiting your practitioner every 3 months. Now, within those visits, it's important that you set up a plan. You have to have a strategy. In this book, once again, I lay out that 90-day plan. I lay out that 90-day strategy. So when you're having that visit with your practitioner, you're there to talk about the previous 3 months. You're there to talk about any issues that you may be having. You're also there for medication adjustment if that's what you, if you're actually prescribed medications. You're also there to re-strategize. If it's working, then you want to continue to do what's working, as well as add on a couple of other things that will also accelerate this progress. And if it's not working, then you need to switch some things up. So in those visits, you and your practitioner needs to be strategizing about what you're going to be doing going forward. So yes, you want to use these visits to talk about other strategies such as fasting, eating whole foods, also working out, and just being active in general. Everything that's going to help you be successful in your overall goal. So it's going to be very important that you and that practitioner have that teamwork. Something else I want to say is that you need to understand that your practitioner does not own you. You're not property of the practitioner. The practitioner doesn't just make decisions for you and you have no say in that. Please let that go. Get that out of your head. I need for you to see yourself as your primary care provider. I need for you to see yourself as the one that is responsible for this whole thing you have. See your practitioner as an advisor. See him or her as a consultant in a business. And see yourself as a business, an enterprise, a company that you have every intentions on making successful. Make sure you see yourself as that, and that you see this person as someone you're bringing in as a consultant to help you increase the health of the business. Okay? They don't own the business. If the business goes bankrupt, none of that matters to them. I mean, they may feel bad for you, but at the end of the day, their business is still running and it's still fine. So you are in complete control of your health, i.e. your business. Please make sure you understand that you are your own primary care provider. They are there to assist you. Now, for some people, 3 months may not be practical. That may be a little bit too much for some people, and I completely understand. So 6 months will be your next option. But the same rules apply. Once you go inside that office, these are the things that you're talking about. Make sure you have all your questions listed out. Make sure that you have a concise plan by the time you leave. Any questions you have should be asked while you're in there. You don't want to walk out the clinic and then try to make a phone call to get in contact with the practitioner so you can ask that question. Good luck getting that question answered if it's a large clinic. All right, now let's talk about some labs that are going to be very helpful and also ideal. Once again, these labs that I'm going to list out in this section, it's not going to be labs that are must-haves. But they will be helpful. And so if you have insurance or you have the financial means to get all of these labs, then I recommend that you get these labs if you have the ability to do it. Okay. So the first lab is going to be the CBC. This is the complete blood count. Essentially, this lab is going to tell you your red blood cell status, your hematocrit, your hemoglobin, essentially whether or not if you're anemic. This lab is also going to let you know if you have an infection. There's a part of this lab called the white blood cell. On the lab, it's going to say WBC. This is for your leukocytes. It's going to let you know if you have an infection. Many times, if your white blood cells are elevated and you have some type of infection that you're unaware of, this can very well stop you from seeing that progress you want to see with your white blood cells. I've actually seen this a couple of times when a patient, an older patient, had a UTI, a urinary tract infection, and they were unaware of it. And it was because their white blood cells were elevated that we were able to find that out, that something else was going on. So with the white blood cells being elevated, oftentimes it's very hard to see that HbA1c decrease because your body's dealing with something completely different that your body sees at that time is more important. So The CBC is very important to get because you want to know if you're low on blood, because being low on blood can also give you erroneous A1C levels as well. But also if you have an infection and your WBC is also elevated, that can give you erroneous A1Cs as well. So you want to get that level so that you can know where your complete blood count stands and whether or not you are anemic or you have an infection. The next lab you want to look at getting is your complete metabolic panel, also called CMP. Now, this is different from the BMP, which is your basic metabolic panel. The CMP is complete. It has way more labs or metrics on it than the BMP. So the first thing you're going to see with the CMP, your complete metabolic panel, is your glucose level, your blood glucose level. That is going to tell you how much blood sugar or how much glucose you have in your bloodstream at that time of the actual lab. The metrics will let you know what's considered to be high and what's considered to be low, but that is also going to be based on whether or not you're fasting. If you're not fasting, then we're just looking for it to be above 140 and we know we have a problem. That's just the general. That's just the gist of it for the actual blood glucose. This blood glucose level being normal does not mean you are not diabetic. It does not mean that you're not pre-diabetic, and it does not mean that you are not insulin resistant. Please make sure you understand that part. Many times patients come in and they'll get that CMP and they'll see that their blood glucose level is normal. They might see that it's like at a 88 or 80 or even either a 70. And they'll think that they're fine. I'm not diabetic, but that's not true. Your glucose at that point can be low and quote unquote normal, and your A1C can still be at a 9 or a 10. Okay, so that blood glucose level is just letting you know what your levels are at that point. Okay, next, what you're going to see on the CMP is your GFR. This is essentially your filtration rate for your kidney. You're going to see several metrics on that lab to let you know what the status of your kidneys are. And this is important because high blood glucose or high blood sugar over time causes damage to the kidney. And so what we're looking at is we want to see if that filtration rate is decreasing. We also want to know if the kidneys are now not filtering the actual protein, because if your kidneys are leaking protein, then that's also a problem, because this shows that there's some type of damage taking place. If the filtration rate is going down, this shows that there's some type of damage taking place. And this is where we start to get into the conversation about kidney disease, stage 1 through 5. So it's very important that you make sure you pay attention to those levels. Next, you're going to see your electrolyte status, the calcium, the potassium. You're going to get to see where those levels are at, and those are very important as well too. However, these are not the levels that are actually inside of your cells. These are the serum in your bloodstream levels, which they're important, but they're not as important as the ones that are inside your cell. I will say that something like an intracellular magnesium, although that is a better lab or better indicator as far as where your magnesium levels are at, it's not practical. That lab is very expensive. And so we need to be aware that just because those metrics are normal, that lab is not the gospel when it comes to your actual electrolytes, okay? Also, by the time the labs that you see, or by the time the metrics such as the magnesium, the potassium, the chloride, by the time those levels start going down, this means that your cells themselves have been low. So by the time you actually see those going down, you know it's an emergency, okay? So also keep an eye on those labs as well. Next, you're going to see some metrics from your liver as far as your AST and your ALT. These are liver enzymes. Sometimes you will see that these levels are elevated. Most people who are type 2 diabetics have some level of fatty liver. And so these metrics may be elevated on the blood work. So your AST and your ALT may be increased. But once again, just because it's decreased or it's normal does not mean that you're okay as far as the fatty liver infiltration. Not everybody's going to actually show an increase when they have fatty liver. In order to really diagnose or rule out fatty liver is to actually get an ultrasound. The ultrasound will actually let you know whether or not the hepatocytes, the liver cells, are actually infiltrated with fat. Next, and this one mostly everyone is very familiar with, and that is your A1C, your HA1C, hemoglobin A1C. Essentially, this is a lab that is it's definitive as far as whether or not someone is diabetic, pre-diabetic, or non-diabetic, as far as type 2 goes. This lab essentially gives you an average of what your blood sugar has been over the past 3 to 4 months. So our red blood cells last roughly 120 days. That is 4 months. But the average is 90 to 120 days. So we're looking at this 3 months to 4 months. So what the A1C does is it gathers that number up as far as what your daily average blood sugar is into one metric. When your blood sugars increase, a portion of that glucose is going to be glycated to the hemoglobin that is inside of your red blood cells. When you have very high glucose in your bloodstream, often, then you're going to have a high amount of glycation taking place on the hemoglobin of the red blood cells. When this takes place over time constantly, we're going to be able to see that be reflected in the actual labs itself called the HbA1c. Now, as far as ranges and what's normal and what's considered to be pre-diabetic or diabetic, if your HbA1c is below 5.6, then you are considered to be non-diabetic. However, if your A1C is in the range of 5.7 to 6.4, then you are considered to be pre-diabetic. And if your A1C is above 6.4, 6.5 plus, then you are what they call type 2 diabetic. All right, so I will say this. For my patients, if their A1C is above 5.6, we're taking action. We are going to treat that as if it's diabetic. Although it may be categorized or listed as pre-diabetic, there's no way in the world I'm going to sit there and talk to my patient and tell them that this is okay. Come back in 6 months and let's see what happens. Come back in 3 months and let's see what happens. No, we need to understand that if it's above 5.6 and you're quote unquote pre-diabetic, the damage is already taking place. The actual foundation and the groundwork for the amputations, the heart attack, the stroke, all these things are already taking place. So it would be foolish of me as a practitioner to make you feel comfortable with being pre-diabetic and tell you to come back in 3 months and we can see what happens. No, we're going to take action right now. We're not going to sit and wait until the pan gets hot. I'm letting you know that you're in the frying pan. It's already getting hot. You need to get out. So once again, the HbA1c is the lab that's going to let you know your status as far as diabetic, pre-diabetic, or non-diabetic. That is the lab, and those are the numbers. Now, you may get those numbers and they may all be fine. They may all be normal. However, that does not mean you're not insulin resistant. And as I always tell you, insulin resistance is the foundation of all of these things that our communities are dealing with. The high blood pressure, the stroke, the heart attack, the type 2 diabetes, pre-diabetes, PCOS. All of these things are sitting on a platform, a foundation of insulin resistance. So although those labs are important and you should get them if you can, I need for you to understand that there's a bigger picture here, and that is the insulin level. So insulin, fasting insulin, is a lab that's unpopular. Most practitioners won't order it, and most insurance companies will not cover it. And so most people have to end up coming out of pocket for that. And I will tell you that is well worth it. So I highly recommend getting your fasting insulin level. Your fasting insulin level is going to alert you to all of this stuff that you're trying to prevent way beforehand. And so if your insulin level is above a 5 fasting, then you are dealing with some level of insulin resistance. It may be a mild amount or it may be a high amount, but you need to understand that for every increment that is increasing, this is causing more damage to your vessels. This is causing more damage to your overall body and health. So your insulin level starts to increase before all these other things that we're seeing even registers as being abnormal. So your insulin level, in my opinion, is way more important than all of these other things. Those other metrics become important once you are diagnosed or you're concerned. But if we're talking about preventing complications and preventing this condition from even happening, then your insulin levels are extremely important, especially when we're talking about fasting. And for fasting, we're talking about not eating anything for 8 to 12 hours. That's going to be the ideal range for fasting in order to get your blood work. The next lab I highly recommend you getting, if you can afford it or if your insurance company will cover it, is vitamin D. Now, you all know I can sit here and go on and on and on about vitamin D. The first thing you need to understand is that vitamin D is not a vitamin, it is a hormone. The next thing you need to understand is that the country as a whole is vitamin D deficient, up to 80%. The most important thing you need to understand is that when it comes to the black community, 90 to 95% of us are vitamin D deficient. Where do we get vitamin D from? You get vitamin D from the sun. What were they telling you about vitamin D? Stay out of the sun, skin cancer. What I need for you to understand is that look at the rates for skin cancer in African Americans, and then look at the rates for vitamin D deficiency in African Americans, and you tell me which one is more important. You tell me which one has had a bigger impact. Now, in my book, Done with Diabetes, I lay out a whole section for the importance of vitamin D, and I lay out the issues that come along with being vitamin D deficient. What you need to understand is that if you're vitamin D deficient, you are playing at a disadvantage, a huge disadvantage. If a Caucasian American being vitamin D deficient is a cold, then you need to understand that as an African American or a person of African descent, you being vitamin D deficient is like having a severe flu, while having pneumonia, while being inside of a burning house, with the ventilator on. I'm just being dramatic right now, but I just need you to know that it's extremely important. It's not anything to mess around with and just kind of, take it easy with, okay? So I hope I've made my stance as far as why vitamin D is important. Please make sure when you get the book, look at the section that I've done on vitamin D and see all of the parallels and connection with vitamin D, heart disease, prostate cancer, especially in black men, and breast cancer, especially in black women. Make sure you check that section out. What you need to understand when it comes to type 2 diabetes is that if you're vitamin D deficient and you're completely unaware of it, and you're a type 2 diabetic, you're going to have a lot of issues when it comes to actually improving your overall status. Why? Because vitamin D plays a significant role when it comes to the health of your overall pancreas, the beta cells, and insulin itself. And if you're vitamin D deficient, this affects the production of that whole orchestra that is supposed to take place when you're eating and during the periods of fasting. So if you don't even know that you're vitamin D deficient, which I'll tell you right now, most likely you probably are. If you don't know that you're vitamin D deficient, then you don't even know to address this issue, meaning that you're going to have problems trying to improve type 2 diabetes, meaning that you're going to eventually get to the point where you just give up and you're going to say that it just runs in my family and there's nothing I can do about it. However, if you get that vitamin D if you get that vitamin D lab and you see that that number is low, then you're going to understand now that I need vitamin D. Also, once you read the importance of vitamin D in the book that I just wrote called Done with Diabetes, you're going to say, oh man, there's other things that I've been dealing with that also correlate with being vitamin D deficient, such as anxiety, stress, depression. And you're going to see that maybe this is causing it. Maybe this is adding on to what I'm already dealing with. So please, if you can afford it, I highly recommend that you get your vitamin D levels. Now, as far as what they consider to be normal when it comes to vitamin D, they just changed it. It used to be that 20 nanograms per milliliter was considered to be normal. Now they have it at 30 nanograms per milliliter being normal. However, as far as I'm concerned, when it comes to African Americans, our numbers needs to be in the 50 to 60 range as far as being optimal. Once again, in my book, I talk about it and I talk about why I feel that African Americans or people of African descent should be in that 50 to 60 range, at least when it comes to vitamin D. All right, so the next lab that I recommend getting if you are able to afford it or if your insurance will cover it is C-peptide. Now, a lot of patients eventually get to the point where their practitioner tells them that their pancreas has burned out and that they no longer produce insulin. And so now they need to actually inject insulin. The only way to know if your pancreas has truly decreased the production of insulin is to actually get a test. One of these labs are called the C-peptide. C-peptide is something produced by your pancreas. Every time your pancreas secretes insulin, it's also going to secrete C-peptide as well. Therefore, if your C-peptide levels are low and your blood sugar is high, then it can be said that your pancreas has decreased the amount of insulin that it's producing. However, if your C-peptide levels are normal and your blood sugar levels are high, then you still have insulin production. Now, in the case of this burnt out pancreas, we need to understand that most people, when they're told that they have a burnt out pancreas, they truly don't. What's going on is essentially the same thing that takes place when the liver is stuffed with fat or has fat infiltration in the hepatocytes. It slows down the production of the liver. Well, the same thing happens to the pancreas. when the pancreas is forced to work because of the high blood sugar, a lot of that sugar is going to get converted to fat, and that fat is going to be stored in the pancreas where it does not belong. Once that starts to take place, the production of insulin is going to decrease, but it's only decreasing because there is fat infiltration in the actual beta cells of the pancreas where it does not belong. Once you start to take action and improve your overall health, start fasting, you're going to start to see that level of insulin increase. All right, so those are the overview of the labs, but those are also the labs that can be very helpful when it comes to tracking your progress on this journey to diabetes prevention and or reversal. Now, the labs that I recommend getting if you're just trying to get the bare minimum, maybe you're paying out of pocket or you don't have insurance, you're ordering labs from a LabCorp or Quest or whatever lab is in your place. If you're just paying for this on your own and you want to get the bare minimum, then this is what I recommend. So if you are trying to keep things to the bare minimum, then there's 3 labs that you can get. The first one being the HbA1c, of course, because this lab is going to let you know whether or not you are diabetic, pre-diabetic, or non-diabetic. And it's also going to let you know where your A1C is compared to where it was 3 months ago, if you got the labs 3 months ago. And that way you can now track it to see where it's going, if it's going up or is it going down. And that way you can use it to really track your progress as far as diabetes reversal and prevention goes. Next, your CBC. Once again, I talked about the CBC. This lets you know really kind of the overall health status of your blood in general. It'll let you know if you're anemic, meaning that you're low on iron, you're low on red blood cells, which means that you're low on oxygen as well too inside your body. It'll also let you know if you have an infection going on as well. And that's important because you may be fighting to try to get this thing under control as far as the diabetes goes, but your body is fighting harder against an infection that you are unaware of. So I highly recommend that you also get the CBC along with the A1C. The next lab that I recommend getting if you're trying to get the bare minimum is going to be your CMP, your complete metabolic panel. The reason being is because this is going to give you your kidney status. I told you all high blood sugar wreaks havoc on your kidneys. And so if you are just dealing with high blood sugar and you're just doing the norm and you've been doing that for a while and you have no idea what effects it's taking on your kidneys, then you're going to be completely surprised when the doctor tells you that you have kidney disease. And so if you're going to be making improvements, which I highly recommend, you need to also see what that's doing for your kidneys. You need to see the improvement in your kidneys, or you need to be aware that there is damage being done to your kidneys so you can know whether or not you need more help from actual specialists or, more help in general. Also with the CMP is also going to tell you about your electrolyte status and also your liver status. All right, so now we're going to talk about what I recommend for my patients when we first start working together or if we've been working together for a while. So, of course, we're going to get the bare minimum, which is the CBC, the CMP, and the HbA1c. We're definitely going to get those, and we're going to actually get those every time I see them for that specific condition. However, in addition to the CBC, the CMP, and the HbA1c, I'm also going to get their vitamin D levels. Of course I am. You know how I feel about vitamin D. And I'm also going to get their insulin level. Of course I am. You know how I feel about insulin resistance. So that mixed with the vitamin D as well as the insulin, I'm going to be able to really get a good picture of what else we need to do, what else we need to be looking out for before moving forward. And then when it comes to tracking them, when they do blood work again, we're going to be sticking to the CBC, the CMP, and we're also going to be doing the HbA1c as well as the urine analysis. The urine analysis, I'm going to be able to see if they have glucose in their urine. If they had glucose in their urine at one point, I'm now going to be able to see that their glucose is decreasing. Now, the other thing that I recommend getting, which is not actual blood work, but it is lab work, is a urine analysis. So there are actual kits in the store where you can get a dipstick and you can dip and you can measure your urine to see whether or not you have glucose or protein or white blood cells, leukocytes, infection going on. And that can be helpful as well too. However, in the lab, we can actually send that off for it to be analyzed under microscope. And that can give us more information as far as, whether or not this person has ketones or this person has proteins in their urine. And all of that can help paint the picture and give us a better idea of what steps need to be taken next. All right, so what if you don't have access to any of those things we just spoke about? No labs, healthcare practitioner, nothing. If that is your situation, then I recommend that you get a glucose meter. This is a little device about this size. And essentially what this device will allow you to do, it'll allow you to be able to see what your blood sugar is at that time you actually use it. This device is going to require that it's going to have a lancet, which is an object that's going to allow you to be able to pierce your skin in order to draw out a small amount of blood. It's also going to have test strips. These test strips are going to go inside of the actual glucose meter. Once you pierce your skin with the lancet and you put the test strip on that drop of blood, that is now going to be able to register on the glucose meter as a blood sugar level, as a blood sugar reading. With that reading, there's a lot you can do. So if you're on a budget, if you are not able to go to the labs or go to the actual office, then this is what you can possibly do. The first metric you can track is your fasting glucose level. The way you're going to do that is go to sleep. Don't eat anything. Don't drink anything before bed. Essentially, you're trying to get to the point where when you wake up, it's been 8 to 12 hours since you've had anything to eat. Once it's been 8 to 12 hours since you had anything to eat and you're waking up, I want you to do your finger stick level and see where that number is at. And I want you to do this every single day and track that. Now, when you're doing your fasting glucose, anything between 70 to 99 is what they consider to be a normal fasting glucose range. However, if you do your fasting finger stick and you see that it's above 100 but below 125, this means that you have an impaired fasting glucose. Essentially what that means is that you are most likely pre-diabetic. And if you see that your fasting finger stick level is above 125, 126 plus, then this means that most likely you are type 2 diabetic. Now, once again, in order to verify these numbers, you have to get your HbA1c. The HbA1c is going to let you know where you're standing as far as pre-diabetes, diabetes, or non-diabetic. So once again, the numbers are fasting finger stick of 70 all the way up to 99 is considered to be normal. Anything above 100 but below 125 is considered to be pre-diabetic, and anything above that is considered to be diabetic. Once again, you have to get the labs A1C to really know for sure. Now, another thing you can do, and I have my patients do this all the time, to track your status or to really see how your progress is going, you can do your finger stick 2 hours after you had your meal. And so essentially what this looks like is you're going to go about your day. You're going to have your meal. Once you have your meal, wait 2 hours and then measure your finger stick. At no point after 2 hours should your finger stick be above 140. If your finger stick levels are above 140, this means that most likely you are at least pre-diabetic. And if you notice that those levels are above 199, then most likely you are diabetic. And I'll say most likely because once again, in order to know for sure, you have to get your HbA1c. That's going to let you know for sure. But 2 hours after eating, your finger sticks should be below 140. If it's above 140, then you're looking at possibly being pre-diabetic. And if it's above 199, then you're looking at possibly being type 2 diabetic. All right, everybody. So there you have it. These are the labs that I recommend getting if you are trying to prevent diabetes and or reverse type 2 diabetes. I highly recommend that you review this video, take notes, and then take action. Make sure you watch the other videos that I have on this channel as far as what insulin resistance is, also signs and symptoms that your blood sugar may be high, also the benefits of fasting. And then last but not least, make sure you pick up the copy of my brand new book called Done with Diabetes. This book lays out a 90-day plan to actually take action and how to go about tracking your progress like we laid out in this video. It's a free book. All you do is pay for the shipping and we'll send it right out to you. All right, family, as always, please let me know if you have any questions below in the comments. Be sure to share this video with your family and your friends, anybody who could benefit from the information. I truly hope that I was able to provide some value for you. If so, please share this video, like this video, also subscribe to this channel. That way you can be notified every time we drop a new video. All right, family, this is your brother Edward Williams signing off. And remember, as always, this is our community, our responsibility. We have what it takes, so let's get it. Peace. And so when you're using the lancet, please make sure that you throw it away. Don't reuse your lancets. Don't use somebody else's lancets. That's nasty. You can get sick. Please don't do that. And so that's why you have to make sure you at least understand what's going on. Because if you leave it to these folks, you're going to mess around and they're going to lead you down a road and